Hello, and welcome to Advanced Rehabilitation Services. My name is Maria Duran, and I am a board-certified occupational therapist, a certified lymphedema therapist, and a certified cosmetic surgery therapist. Today, we will be talking about and demonstrating how to perform manual lymph drainage of your lower extremity. To start, I would like to emphasize the fact that we are going to use a moisturizer of your choice. It could be an oil. I like to use castor oil, or you can use a cream. This is a generic brand for Eucerin cream. It could be a lotion of your choice, whatever you would like to use to keep your skin moist and also to allow you for that skin-on-skin contact. I'll be showing that later. So keep these for now here. We're going to start by opening up the lymphatics in which we're going to be dumping all this fluid into, or they're going to absorb the fluid that it's been congesting our lower extremity. So we're going to start by opening up the lymph nodes up here on your clavicle area. Okay, I'm going to do it one at a time here so you can see better how you can perform that. So you're going to look for your clavicle. And just above your clavicle, you're going to find like a hollowness. And what you're going to do is you're just going to do semicircles. Some people like to do circles. You put a little bit of pressure there to stretch the skin. And then I'm going to do it on the other side as well. So you're going to do it about 10 to 12 times. If you want to stay there for a little longer, 15 times is fine too. So somewhat like a scooping motion. I'm going to go back onto my skin. Okay. Once that is done, I'm just going to move this over here. You are going to lay down on the area where you are, and you're going to open up the lymph nodes on the affected extremity. If both are affected, you have to open it on both sides. I'm going to start with one side only here. You're going to look for the area where your trunk meets your hip. Okay, right here in this crease, you're gonna open up the lymph nodes in this area. So the way to do it is you're gonna do semicircles and you're gonna push it towards your belly, okay, towards the belly. So this way, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. My hand is sitting on top of the bone here, the pelvic bone here. Okay, that's where you're gonna work that. You can also do it on the side of your hip, here in your hip area. Same thing, semicircles, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remember, this has to be done as skin-on-skin contact, okay? I'm wearing shorts in the privacy of your home. You can be on your underwear and have that skin-on-skin contact, okay? Next thing you're gonna do is you're gonna bend your knees and you're gonna do the deep breathing technique. Okay, you have to ensure that you're not doing this. Okay, that is incorrect. So you're gonna relax everything. You can close your eyes, okay? You can put pillows under your legs if you like to do that, just to relax your entire body. And then you're gonna take a deep breath in through your nose, and you're gonna do very slow exhale through your mouth with your lips pursed. I'm going to demonstrate the technique. My hands are going to be on my belly to show you how my belly is going to go up when I inhale and how it deflates slowly when I exhale, okay? I'm going to teach a technique. In through your nose and out of your mouth slowly. And again. The deep breathing technique is going to help you relax. It's going to help also open up the lymph nodes in your abdominal area. Very important, because now we're going to be moving all that fluid from your leg onto the inguinal lymph nodes, which we just opened up, your abdominal area, and everything else might migrate over to the neck, okay? Next, we're going to start doing the manual lymph drainage of the leg. Okay, so we're going to start with the manual lymph drainage of your leg. For starters, I'm going to put some of castor oil. That's what I like to use on my skin to moisturize the skin, as well as to provide me that skin-on-skin contact. Doesn't have to be a lot, just enough to provide you with what I just mentioned, the tools that you need to mobilize this fluid. So once we have opened up the areas, as I showed you before, we're going to start by cleaning up the side of your leg. So you can use your opposite hand and you just stretch the skin towards those areas that you opened up. Again, you're just resting your hand on the leg and you're just pulling the skin. If this is hard to do, you can do it on the same side of your leg. You can use so left leg to left arm. We're going to do that 5 to 7 times. Okay, I'm doing 3 for demonstration purposes. Next thing you're going to do is you're going to start pulling the fluid from the center of your thigh over to the side of your thigh, okay? This direction. You can start at the top. So what I'm doing is I'm using my hands, just stretching the skin to move that fluid over. As you can see, you can use both hands. Push, push, very slow, sequential manner. Like doing those semicircles like I showed you before. Going back to the center of the thigh, in the medial part of your thigh, that's in the middle of your thigh, in the inner side of your thigh. So you're going to do that a couple of times. Again, I'm going to demonstrate with one hand. Semicircles like this. Again, my hand is just resting on the skin. I'm not forcing, I'm not doing anything. You see? And this is the motion. I'm doing the same motion of my left onto my right so you can see what it's like. I'm going to do it one more time on the top. You can go as high as you want, okay? You can go up here too. And then what you're going to do is, with both hands, you're going to cup the back of your knee and like this, gently. Do not tighten your hands like this, like a belt. Gently. And then what you're gonna do is you're gonna massage the back of your leg to open up, the back of your knee, excuse me, to open up those lymph nodes there. Like so. So this is the motion. I'm gonna go back in there again. And now you're gonna work on your knee. Same thing. Cupping the kneecap. Not a stiff hand. Always your hand is just sitting there, gently. My fingers too, as you can see, they're very gently sitting there. They're not stiff. Again, you need to have a skin-on-skin contact. I'm gonna do it 3 times. This is my 3rd time. You can do it 5 to 7 times. And now you're ready to clean this area. Again, pulling the skin. Remember, towards your heart. You can do it with the other hand. And the last time. 5 to 7 times for you. I'm just, for showing purposes, I'm gonna do it 3 times. Perfect. Next, we're gonna do the leg, the lower leg, excuse me. With the lower leg, the motion, you're just stretching the skin up. I'm using both hands because there is more area to cover in your lower leg. And you're gonna bring it towards the knee. I'm gonna show you another way that you can move the fluid up. You can cup your hand on your lower leg. You can do the sides. Again, you're bringing everything towards the knee. And you can do the back of your leg towards the back of your knee. Okay, now you're gonna work on your foot. So to work on your foot, I'm gonna put a little bit more of my castor oil. Okay, make sure I coat the skin really nicely. Okay, so you're gonna open up the lymph nodes in the back of your foot, okay? Very important. So what you're gonna do is you're gonna come here to the back of your foot, okay? This area here where the Achilles tendon is, okay, right there. It's the Achilles is right here in the middle. You see that it's popping out here. This is your tendon right here. In between the tendon, what you're gonna do is you're gonna do all those semicircles. 1, 2, 3, 4, 5, 6, 7, 8. I'm using my fingers, so you're kind of like scooping. That's the motion. Scooping. Once that's done, you're gonna work on your foot. You can use both hands to address the foot part, bringing the fluid towards the lymph nodes that you just opened up in the back of your foot. Not applying a lot of pressure, but just enough to push that fluid out. You can sit there for a few repetitions if your foot is the problem area. Next, you're going to do your toes. So you make sure you have oil on your toes or cream, whichever method of moisturizing your skin you prefer. And then you're just going to start at the bottom of your toe and you're going to push the fluid towards the heart. Remember, everything goes towards the heart. Then the top of the toe, back to the bottom of the toe, next toe. Again, 5 to 7 times. If your toes are a problem area, you may need to sit there for a few more repetitions. And try to target the entire circumference of your toes. Don't just sit in the front and the back or only on the sides. You go around with your hand. Targeting every part of your toes. And now my little pinky toe. Top of the toe. Back to the bottom of the toe. And now that you push that fluid out of your toes, goes back onto your foot. And again, you push the fluid away from your toes and your foot now. Gonna do it a couple of times. You can even do like a sandwich of your toe. So you target a wider area of your toe, of your foot, excuse me. That feels so good. Next, you're gonna go back onto that area that I showed you before. Between your, so in the middle is your tendon. And put your fingers there and you're gonna do the circles, the semicircles again. Like so. 2, 3, 4, 5. You can do 5 to 7 times. Next, you're gonna push that fluid from your leg, from your foot, excuse me, to your leg. And from the leg up to the knee again. I'm showing you different ways in which you can do it. Cupping of your hand, like little scoops. So the skin has to stretch, has to move to get rid of that protein, rich fluid from the area. And you go all around. If you don't possess that mobility, you may need to have another person help you work this fluid out of your affected extremity. Okay, so we're back at the knee. Again, you're gonna do those scoops on your knee, the back of your knee, to move that fluid that you just dumped in there. And now you're gonna work on your knee. Okay. Now you're gonna move the fluid along your thigh. Remember, towards the heart. Stretching the skin. Always stretching the skin. That's the whole purpose of this therapy, self-massage, to get rid of that fluid. If you're not stretching the skin, you're not doing it right. Okay, now that you're here, you're gonna work again your thigh area. I'm showing it to you 2 hands. You can also do it 1 hand. Again, that motion. Stretching the skin. The back of your leg, same thing. You can use both hands to push the fluid from the center of the thigh over to the back and to the side. You can help yourself with your other hand. Remember, you're bringing the fluid to the middle of the thigh right here, where the gutters are, okay? Once you have pushed the fluid to this area here, now you're gonna push it away from here, stretching the skin, mobilizing it away from your skin, from your affected area. Okay, and this is how you will perform your self-manual lymph drainage of your leg. After you perform your manual lymph drainage, you have to go onto your compressions. Okay, the reason is that that's what's going to help keep the area from refilling again, and it's going to help also with the mobilization of the fluid through the use of your muscles. Do not sit at home. Do not just do anything. You have to move, okay? You can perform your home exercise program after you put your compression garments. Very important. The best way to mobilize the fluid outside of manual lymph drainage is through pumping of your muscles, okay? Other things to remember, to keep in mind, is make sure that your skin is always moisturized. You don't have any broken skin. You don't have any issues with your nails. Make sure that everything is clean. Your skin has to always be clean, okay? Try to avoid excessive sweating, like behind your knees, in your area between your hip and your trunk, the inguinal area, because what happens is if it's excessively wet, then you can create an environment in which fungal infections are gonna thrive, and you don't need those problems that lead to hospitalizations and other issues that make even more difficult to live with this condition. All right, please, if you have any questions, feel free to reach out to my clinic, or you can leave a comment below. I look forward to working with you on your path to better health.